I am here to be the voice for the children whose voices can't be heard. While this committee has the responsibility to move bipartisan solutions forward to protect them, I strongly advocate for the reauthorization of Title 4B. Families need resources and support so they don't need to come into the child welfare system in the first place.
A few months ago, I had the great pleasure of meeting with one of our witnesses, Ms. Paris Hilton. She shared an incredible story of suffering physical and psychological abuse at a congregate care facility as a teenager. What happened to her should never happen to any child in America. Since that difficult experience, Paris has used her platform to shine a spotlight on abuse in the child welfare system. Standing with her are many foster youth who have also experienced abuse and trauma at a moment when they needed love and support most.
Thank you. Chairman Smith, Ranking Member Neal, and members of the committee, I appreciate the opportunity to be here today to discuss how to improve care for the nearly 400,000 children that are living in the foster care system as we speak. While my experience was not through the foster care system, I know from personal experience the harm that is caused by being placed in youth residential treatment facilities. When I was 16 years old, I was ripped from my bed in the middle of the night and transported across state lines to the first of 4 youth residential treatment facilities. These programs promised healing, growth, and support, but instead did not allow me to speak, move freely, or even look out a window for 2 years. I was force-fed medications and sexually abused by the staff. I was violently restrained and dragged down hallways, stripped naked, and thrown into solitary confinement. My parents were completely deceived, lied to, and manipulated by this for-profit industry about the inhumane treatment I was experiencing. So can you only imagine the experience for youth who are placed by the state and don't have people regularly checking in on them? I attended facilities with foster and adopted youth, and I heard their testimony that they feel like they were forgotten, being shipped from facility to facility their whole childhoods. Today, residential facilities are continuing to warehouse over 50,000 foster youth and unknown number of adopted youth in lockdown facilities. Innocent kids who have not committed crimes, kids whose parents didn't have resources to support them, kids whose parents passed away, kids who have already experienced trauma. This $23 billion a year industry sees this population as dollar signs and operates without meaningful oversight. It costs approximately $800 to $1,000 per day to place a foster youth in a facility, significantly more expensive than serving them in their own communities. What is more important, protecting business profits or protecting foster youth lives? 16-year-old Cornelius Fredericks was placed in a facility because his mom tragically died and his dad was in prison. His life ended after being tackled and violently restrained by 8 staff members for nearly 10 minutes after innocently throwing a sandwich in the cafeteria. They killed him on the floor of the lunchroom in front of dozens of other children. Emergency services had been called 300 times in the year leading up to his death, with 56 violations substantiated by the state. The state could have prevented this. Jasion Terry's life ended at just 7 years old. In his final hours, he was publicly shamed, verbally abused, left in his room alone for nearly 6 hours, and physically restrained by staff members until he lost consciousness. When first responders arrived, there was vomit in his mouth and throat, running down his cheeks and onto the floor. Why can't we as a society see that these kids are hurting? They need love and kindness, not beatings and restraints. As a mom, these stories break my heart. When your child is born, your heart is full of love of all hopes and dreams you have for them. I assure you that these were not the dreams that were envisioned for Cornelius, Jasion, and thousands more who have suffered immensely. I am here to be the voice for the children whose voices can't be heard. While this committee has the responsibility to move bipartisan solutions forward to protect them, I strongly advocate for the reauthorization of Title 4B. Families need resources and support so they don't need to come into the child welfare system in the first place. For children who do end up in foster care, we cannot allow them to grow up in facilities. The treatment these kids have had to endure is criminal. These kids deserve to grow up in safe, family-centered environments. I will not stop until America's youth is safe. I've helped pass 9 state laws on this issue. I am strongly advocating for the federal bipartisan Stop Institutional Child Abuse Act. I supported the Senate Finance Committee report, Warehouses of Neglect, that validates everything those with lived experience have been saying. And I recently went to Jamaica to support and find appropriate placements for American adopted youth who had been raped, waterboarded with a hose, and held in solitary confinement in a facility internationally. Their parents had adopted them when they were young, promised them a better life, and then shipped them off to an international facility to be warehoused there until they turned 18. How could we let this happen to them? Progress isn't an option anymore. It's a life or death responsibility. If you are a child in the system, hear my words. I see you, I believe you, I know what you're going through, and I won't give up on you. You are important, your future is important, and you deserve every opportunity to be safe and supported. Congress, please join me in creating a world where all children have a right to family, love, education, and the support they need. Thank you for your time, and I'm happy to answer any of your questions.
We'll start with the question and answer session. Ms. Hilton, you have personal experience with congregate care facilities, and you've been a champion for individuals impacted by their experiences in those care environments, especially teenagers. As you know, this committee is currently working on reauthorizing the child welfare programs and looking at how we can ensure additional resources are available to foster youth and children in need, with a focus on keeping them in their homes and united with their families. Based on your experiences, is that a priority you believe we should be focused on, and what reforms do you think we should be considering to achieve these goals?
Thank you for the question, Chairman Smith, and thank you so much for visiting the facilities. I want to applaud the committee for taking the time to consider how to improve the foster care system. These youth don't have a voice, and anyone checking in on them on their well-being. Locking kids in facilities is harmful, and from my own experience, has caused me severe post-traumatic stress disorder and trauma that I'll have for the rest of my life. We need to reauthorize Title 4B and invest in kinship care, placement with a relative, as youth should be with family or adults who know and love them. I would also like to see the Stop Institutional Child Abuse Act passed, as we need more transparency of what is happening in treatment facilities serving foster youth. The cost of treatment is 5 times more in a facility than community-based services. It is a completely ineffective use of funds, and it hurts the kids and costs the taxpayers more. I think it's so important to listen to youth voices about foster care. It is so crucial, because the ones who've experienced it are the ones who should have a seat at the table. They know the best, and I hope that everyone here prioritizes people with lived experience, as they are the true experts.
I want to also thank our witnesses. I know Ms. Hilton has been in my office, and a lot of other offices up here on the Hill, so you're relentless. And I'm a grandfather of 10 children, 9 and under, and but I read that the country is made up of 25% are kids, but they make up 100% of the future. So exactly, your work and the committee's work is huge. I thought I'd just ask you, what are the things you said you've been involved with 9 different states, are the biggest potential impacts that we can help you and others to get the best return for the taxpayer, but have the biggest impact in terms of our kids in the country? I know there's a lot of needs, and it's very easy to get pushed in one direction or another, but what would be your couple of big things that we can make a big difference in and weigh in on?
Thank you so much. I appreciate your kind words, and I appreciate your question. And I'm working at both the federal and state level to enact change. At the federal level, I want to see Title 4B reauthorized, and I want to see the Stop Institutional Child Abuse Act passed to provide transparency and data collection. At the state level, I've helped to outlaw abusive practices like restraint and seclusion, increased licensing requirements with unannounced site visits, required proper reporting, and increased private communication with families and their child so they can report abuse if it's occurring. All of this helps to reform these facilities, and I will not stop until all youth are safe.
What do you think that this committee can do in our reauthorization legislation that would best help not only making these facilities more transparent, but ensuring that if children are at these facilities, they receive the proper care and services that they need?
Well, thank you so much. I really appreciate what you just said. And I think it's just important for there to be oversight and regulation. People need to know that they're being watched. What I experienced in these places was inhumane, and it's something that will affect me for the rest of my life. And after speaking to thousands of survivors who have been through the same experiences, I think it's just important to listen to survivors because we have the lived experience. And I just want to say again, I'm so grateful to be sitting here in front of all of you who could help make a difference in so many children's lives. And I think it's just continuing to do that and to pass this.
Ms. Hilton, I first read about your story in Vanity Fair. I don't usually read that magazine, my wife does. And she said, you have got to read this story, and you won't believe what happened to her. Your very presence here, believe me, we have a lot of briefings here, but we don't get this type of a crowd, and we certainly don't get that many people who come in and from the media and want to get pictures of us. You telling what happened to you in your life and what happened is absolutely incredible and opens up a whole new vision for the rest of us to say, you know, if she has the courage to stand up and talk about this and relate what she went through, certainly we should look at our own lives and our own communities and say, why can't we also look at that and make sure? So I can't tell you how much I appreciate what you were able to do and why you did it. And I knew it was selfless, but I know it has had a great impact. So thank you so much.
Thank you so much. I have tears in my eyes. And tell your wife thank you so much as well. And it's an honor and a pleasure to be able to do this for the children who have no voice and be the hero that I needed when I was a little girl, terrified in these places. And it's just so heartbreaking to know that there's hundreds of thousands of children that are in these places right now. And for so many years, nobody has been believed or listened to. So I feel that maybe God put me through this and gave me this special gift. So one day I could use it to help others not go through what I did and really turn my pain into a purpose. And thank you all for coming today and everyone, because this is so important for the world to know what's happening and for the children in there to know that we're all here today to help make a difference in their lives.
There are 2.7 million children who are Social Security recipients. And Mr. Geen, you remarked most of the children receiving care are not infants. They come because of a deceased parent. Yet, here we are talking about what we need to do. How about the fact that Congress hasn't voted to enhance Social Security in more than 53 years? Is there anyone on this panel who doesn't think that enhancing Social Security so it doesn't reflect what it was providing in terms of benefits in 1971 shouldn't be enhanced to take care of the very children you're talking about in terms of making sure they have the adequate resources? Ms. Hilton, I'll start with you.
Thank you, Mr. Larson. Yes, I think it is extremely important, the point that you're making, and the fact that it has not been changed in over 50 years is ridiculous, especially with everything that's inflation, everything that's been happening. It's a whole different world now, so these need to be addressed and changed. I 100% agree with that.
We cannot allow the private equity octopus to reach its tentacles in child services. So, Ms. Hilton, Thank you for your comment that this $23 billion industry sees children as dollar signs. Who wrote that and said it? We're sending youth a signal that profit is more important than their lives. Very well stated. Just unpack briefly for us why the for-profit industry is so dangerous here in what we're talking about.
Thank you so much for that. And it's so dangerous because they're caring more about profit than the safety of children. And that means that they are trying to spend as little money as possible. And the type of employees that they're hiring are people that are not being checked through. They're people that should be nowhere near children. And just the entire situation. There's no education in these places, the food quality, the living conditions, there's mold and blood on the walls. It's horrifying just what these places are like. They're worse than some dog kennels that are out there. It's terrifying. And all of these private equity companies are seeing that this is such a profitable industry, so they're caring more about the bottom line than children's lives.
So what you're saying really is there's a vacuum here of service. We're trying to fill that vacuum, yet other people are vacuuming up the money when they say that we'll be helpful here. This is dangerous to me.
Extremely.
Government can't do everything, but what we do ought to be effective, and people ought to be accountable, and we ought to have the highest standards, and that's what I'm hearing from each and every one of you, and so thank you again. God bless you. Paris may be known more than any of you, but you're all stars, every one of you, okay? Now, Ms. Hilton, you talked about the several pieces of legislation that you've worked on throughout the country in various states. And you mentioned that you had some folks checking on you that saved you from further abuse in the system. And you said, can you imagine what it would be like if you didn't have parents and family who were checking on you? So let's talk about how we check on these vulnerable people in this system at the state level. And then I'll get to the role of the federal government. What's your experience in terms of the best practices around checking, oversight, and accountability? Just give me a few ideas that we could consider as best practices throughout the many states in this great country.
Well, for me, all of my outside contact was completely controlled, and they would always have a staff member sitting right next to me. So if I said even one negative thing about the facility, they immediately would hang up the phone, and then I would be punished and either physically beaten or thrown into solitary confinement, and then they would take away my phone privileges and not let me speak to my parents. So they had no idea what was happening because they were continually being lied and manipulated by the staff that were trained to do that. And there were other children in there that were foster children, and they had nobody to call, no one to talk to. So all of the kids in these places, they're not able to speak to their families without someone sitting right next to them. So it's really difficult to be able to tell anyone what's happening in the outside world. And then a lot of these kids are not believed because these places tell the parents, oh, they're going to be lying, they're manipulating you, they want to go home. So I think it's really important that children are able to speak to their families without someone sitting directly next to them, where they can have unmonitored phone calls with their family. And if they don't have a family member, that they should have someone on the outside world that they could talk to, because otherwise these children are in there and they have no voice, no one believes them, and it's extremely isolating, and it is extremely traumatic. And that's why I want to continue for the Stop Institutional Child Abuse Act as well, because children need to have the right to speak to someone to tell them what's happening.
And there seems to be a major problem with just over-prescribing psychotropic drugs and just saying, here's a handful of pills. Can you share with the committee your experience with that, and do you think that that is a problem in our system today, and what you think you should do to correct that, or what we should do to correct that?
I think it's a huge problem. Before I went to Provo Canyon School, the only medication I had ever taken was a Tylenol or an Advil for a headache. I had never been on any medications that they prescribed, which weren't even prescribed by a doctor. And every morning, every lunch, every afternoon, we would give us all a cup full of pills. I had no idea what they were. All I know is that I would feel dizzy, I would feel my memory would be gone. It was almost like they were just trying to make everyone like zombies. It was just very concerning. And I think that they're definitely abusing that power where they are just giving children medication that they don't need. And I think that's something that really needs to be looked into.
I'd like to turn to you, Ms. Hilton, now. First and foremost, thank you for using your platform and personal story to bring attention to such troubling experiences that so many youth are actually facing in our foster and residential treatment homes. It's critical that we keep the well-being of children at the forefront of all these discussions, and you have been tireless in turning your personal trauma into advocacy on the behalf of troubled youth. And we hear a lot about the increase in mental health disorders in youth, including disorders like ADHD, depression, anxiety, suicide. In my home state of West Virginia, we also struggle with high rates of substance disorder children and have been fighting the opioid epidemic for years and years and years. And far too many young children are struggling with mental health and unable to get the support they need. Parents are often at a loss as to how to help their children, and they don't really know how to access. How do you think we can improve the support we give to teens and youth to help them cope and to have a healthy transition into adulthood, especially when you're talking about foster youth who've already had so much trauma?
Well, thank you so much, and I'm grateful that we're having this discussion to figure out what kids need. I think that the first step is asking the youth. We should prioritize lived experience voices to ensure that we truly understand what could help them, and then figure out how to do that. I believe youth need access to mental health in their communities, mentorship, and community. We do have a mental health crisis for our kids, and it scares me for my own children. I'm confident that we can bolster support for children and their parents in the community, and will prevent trauma by removing children and placing them in facilities, as no child should spend their childhood in a facility.
Could you talk more about your bill, the Stop Institutional Child Abuse Act, and maybe specifically why you think it will make meaningful reforms to congregate care?
The most important thing about the Stop Institutional Child Abuse Act is about transparency and accountability, and people need to know what's happening behind closed doors.
And you believe if it passes, if the bill passes, that it'll achieve that means to an end?
I think it's the first steps to it. I just think it's so important for people to know that, to be held accountable for what they're doing, and for there to be transparency. These are our children, this is our future, and there needs to be checks and balances on what's happening to the most vulnerable people in the world.
And surely we can all agree here that we need to do better by the children who are put in our care. But doing better by these kids isn't free. We need to increase the funding towards safe and quality programs that ensure children's safety. And we need to be funding programs that stop children from entering foster care in the first place. So things like investing in community-based prevention and protection services, and ways in which we can help keep kids with their parents or their extended family members, or even just within their own communities, I think is really critical. I just want to know, Ms. Hilton, I'll start with you. Would you agree that providing increased funding for programs that help keep kids out of foster care and ensure that they can remain with their families would be a better benefit to these kids?
Yes, I do agree with that. I believe that we need to keep children safe in their own homes and with their families as much as possible. And I believe that we should reauthorize Title 4B to provide necessary funding to help bolster community resources and to help keep families together.
Your advocacy has brought these issues to the forefront, and that's why I've introduced a bipartisan bill with Mr. Panetta of California. Our bill, H.R. 8817, aims to increase transparency for residential treatment facilities by developing guidance on best practices for federal agencies and states. The guidance will focus on collecting data and sharing information related to youth well-being in residential treatment facilities, improving data on maltreatment, and enhancing oversight of youth residential programs that receive federal funding. My first question, Ms. Hilton, is do you think it's important that federal agencies work with each other to address these issues?
Thank you. It's so great to see you again, and thank you for your dedication on this issue. By introducing that bill, all the survivors and I are so grateful to you for taking action on this issue. And I believe that interagency collaboration is very important. These facilities treat foster youth, kids in the juvenile justice system, youth with disabilities, and youth with mental health issues. I think all the agencies must work together to address the abuse and neglect that is happening, and we can't fix the issue if we don't look at it as a whole.
I know you've worked with state legislatures to pass legislation for enhanced oversight of youth residential facilities. Can you share any examples of states that have implemented particularly effective reforms?
I know with Utah that we've made a lot of progress with children being able to speak to their families without someone sitting right next to them, also with medical restraints. That's another issue that we have been resolved almost. And yeah, I think it's just important that we continue using our voices so that we can pass this bill.
What specifically do you think we could do to add mental health and counseling support, and how can we incorporate that in the bill along with trying to meet the goals that are already in this reauthorization?
Well, thank you. I enjoyed our Zoom call, and I love your jacket. The sparkles are amazing.
I had a little bling here for today.
Yes. I wanted to find out who made it later. But I think the most important thing is they need access to therapy, counseling, mentorship, and other community-based programs. And I think it's also important to not label these kids as troubled or bad. I think it makes these children feel like they aren't believed, and that's something that's important for them to not feel that way. And yeah, I think it's just about showing kindness and love and compassion and support and giving these kids life skills that they can use in life, because otherwise we're just setting them up to fail.
Did you have access to any of this therapy or anything when you were in your situation?
No, and I was only sent there because I was getting bad grades. I was just ditching classes. I have ADHD, and that was something that they weren't really just talking about back then. So somebody recommended that I go to these schools. My parents had no idea. They just thought it was going to be a normal boarding school. And when I got there, there was no therapy. We would just constantly be torn down, abused, screamed at, yelled at, no education whatsoever. I learned nothing there except trauma.
Texas ranks among the top states for kids in foster care with more than 31,000 children in the system, most of whom suffer neglect, drug abuse by a parent, and physical abuse. The further mistreatment and lack of proper care for these kids is inexcusable. Ms. Hilton, from your experience, what are the outcomes for youth placed in these kinds of facilities?
Thank you for highlighting that article, and it's so concerning what foster youth have experienced. The outcomes for this youth are horrible, and children are being abused and dying in these kind of facilities, and just surviving is the best case scenario. I feel grateful where I am in life after my experience, but most don't end up having access to education, and they end up homeless, having trauma, and a high percentage commit suicide because they don't know how to deal with the experience. The government is paying for this abuse, and we must stop it.
Family First requires the Qualified Residential Treatment Programs, or the QRTPs, to have a licensed clinical staff available 24/7. Based on your advocacy and the experience, are these staffing requirements being met consistently and effectively?
Well, thank you. My team and I love working with you and your team, and happy birthday to your mom as well.
Thank you.
And I appreciate the committee's work on Family First. I'm not a policy expert, but based on my lived experience, the staff are untrained and unfit to work with children. Licensed staff is important, but the floor staff, the people who do the overnight shifts and the hard work, they need to be looked at as well. These facilities keep staffing costs as low as possible to increase the bottom line. In my case, many staff enjoyed abusing the children because they knew they could get away with it. They would take kids to rooms without cameras, beat them up, and physically and sexually abuse them. There's a lot of sexual abuse that happens. I just heard a situation right now where a 12-year-old foster youth is pregnant because she was sexually abused by staff. I think we need stronger oversight over who works with children, as children are dying at the hands of these staff.
And really, as kind of as a follow-up to that, what further training or education requirements should be imposed on staff in these facilities to better support and protect our youth, in your opinion?
I think that there needs to be checks on these people and background checks as well, and they need to be trained in how to deal with children. And I think that you guys could speak better on that.
Well, that's all right. I'm about down to a minute, and I appreciate your testimony.
I am proud to sponsor the bill being advocated for by you, Ms. Hilton, Stop Institutionalized Child Abuse Act. I think it's a really great step. I know that you've had some success in passing this legislation on the state level. Can you talk a little bit about the changes that you've seen happening in the states as a result of this similar legislation?
Yes, we've helped pass 9 state laws, but that's not enough. It needs to be on a federal level. But the positive part about it is that people know that they're being watched, but abuse is still happening and children are still dying in the name of treatment. So that's why the Stop Institutional Child Abuse Act is so important, and thank you for supporting it. I really appreciate that.
I'm a new parent. I have a 22-month-old toddler. I have the scars to prove it, physical scars from him trying to bite me once in a while. But I know that we're trying to do more here, and that's why one of the things I did was I started the Dads Caucus, so that dads would actually do more at home to help raise children, but also for dads to do more here in the halls of Congress to fight for family-friendly policies that really help kids and families everywhere. And in your testimony, Ms. Hilton, you mentioned that families need resources and support so they don't need to come into the child welfare system in the first place. Could you elaborate on the need for more federal resources for children?
I think it's really important because a lot of the things that are happening to these children is because they don't have the funds, and then they're going to be going into the system because of that. And sometimes their families can't afford to take care of them, and it's just heartbreaking that because of that reason that they would be taken away and then locked away in these facilities and being abused. So I just think it's important for that to be taken care of before, so that they will never have to go into the system and be put through this abuse.